Hello, my name is Isaac Tet. This is Exercise and Sports Related Nutrition, Kinesiology 5005, Dr. Everman. So, the intention of this video is to address if alcohol consumption has a negative effect when it comes to athletic performance. So, a lot of athletes may participate in recreational drinking for various reasons, such things as maybe socialization is a big one, relaxation, maybe celebrating after a big game or such things like that. But the effects that alcohol has in regards to training is pretty negative. I mean, when you think about alcohol in itself, it has a lot of negative effects when you drink excessively, much less integrating it with athletic training, right? So research has shown that excessive alcohol consumption may lead to testosterone reduction, reduction of glycogen synthesis, and promoting dehydration, which those three factors right there are pretty negative when you think about resistance training or endurance training alone. So I want to go ahead and just dig into the negative effects that it plays in testosterone production. So a study by Anders and his colleagues in 2013 showed that individuals who ingested 1.4 grams per kilogram of body weight of alcohol compared to individuals who consumed 0.7 grams per kilogram of body weight of alcohol, it didn't show to hinder protein synthesis, it didn't show to hinder muscle force production, but what it did show was that it reduced testosterone production and increased cortisol levels, which is pretty terrible when you think about it in resistance training terms. So this study was conducted in recreational male weightlifters. Another interesting finding was that Anders and his colleagues in 2013 presented was that the effects of testosterone reduction didn't occur in individuals who consumed 0.7 grams per kilogram of body weight of alcohol. It only occurred in the individuals who consumed 1.4 grams per kilogram of body weight, which according to Anders and his colleagues in 2013 is the 1.4 grams per kilogram of body weight is roughly around 11 standard drinks, which is a lot when you think about it, right? It's a lot of drinks to consume, I guess, definitely in one sitting. So, but I mean, athletes certainly do that. I mean, when it comes to celebration and such things like that. But hindering testosterone isn't something that you want to do in regards to resistance training. It can reduce hypertrophy. Testosterone is a very powerful anabolic hormone that basically helps us when it comes to resistance training. It promotes muscle growth. So hindering that, decreasing that, and increasing cortisol levels is definitely not a valuable thing you want to do with regards to resistance training. So another topic that I want to go ahead and get into is the reduction in glycogen synthesis. So as we know, glucose is our form of energy. When we work out, we basically use that energy, so we have to restore it somehow. So hindering that in any which way isn't going to help recovery, which is a big part of resistance and endurance training. So a study that I want to present by Greg and his colleagues in 2011 mentioned that in well-trained cyclists, they did 3 groups here. So what they did is they had a group who consumed just straight carbohydrates after exercise, another group who consumed just pure alcohol after exercise, 1.5 grams per kilogram of body weight to be exact, and then another group who ingested 1.5 grams per kilogram of body weight with carbohydrates. And certainly the group that ingested just no carbohydrates and alcohol had a significant decrease in glycogen synthesis. The interesting thing, though, that Greg and his colleagues in 2011 presented was that the group who consumed alcohol and carbohydrates had a significant decrease at the 8-hour mark. But overall, the glycogen synthesis wasn't significantly different. But at the 8-hour mark, it was different. So what they state is that 8-hour slowdown basically had to get caught up somehow. So it potentially may slow down recovery rate, which isn't good. They said the reason was unknown for that, but nonetheless, though, they did say that it may hinder recovery rate because of that catch-up marker. Interesting. Another component is hydration. As we all know, dehydration could lead to a lot of things. It could lead to hypothermia, which could lead to death, which is something that you definitely do not want to see when you're exercising. So staying well hydrated is just a component of just being healthy in itself. So I want to present a study basically by Sheriffs and his colleagues in 1997. And what it showed was that consuming 0.2 grams per kilogram of body weight, 0.4 grams per kilogram of body weight, and 0.92 grams per kilogram of body weight, those were the three groups. They consumed that amount of alcohol prior to or after exercise. And what it showed was that the only group to have a significant increase in urine output and reduced recovery rate of blood volume, thus hinder rehydration, was in the group that consumed 0.94 grams per kilogram of body weight. So it didn't show to be significant in the group that consumed 0.49 grams per kilogram of body weight, or much less in the lower group. So this is kind of consistent with what we saw from Anders. They showed that excessive amounts is what hindered testosterone reduction, and then also when we look at Sheriff's study, they presented similar results, necessarily with regards to dehydration, but in regards to the excessive alcohol amount that was consumed. So what could we say from this research? Basically, is we could say that this research presents that small amounts of alcohol may not necessarily hinder performance, but when you start to drink in excessive amounts, that's when it starts to hinder performance. So I mean, having a couple drinks, having a drink, maybe a drink or two drinks after, not necessarily right after a workout, but later on or during, just in general, having a drink or two drinks may not necessarily hinder performance. But when you start to binge drink and get drunk, that's when things start to turn a little bit. So what I could say is that the research presents that excessive amounts of drinking may hinder performance, and that consuming low amounts of alcohol doesn't necessarily hinder performance, athletic performance. And this was in regards, we saw a study that worked on resistance training and a study that worked on endurance training. So those are both two components of sports performance right there. But that is what the research basically states. Again, these studies were conducted on very healthy individuals who were allowed to drink, and definitely over the age of 21. So those are some things to consider. Unhealthy individuals should definitely consult with a medical provider to basically determine their amount of alcohol that they could consume. But I'd like to thank everyone for watching my video, and thank you. I enjoyed it.